Hello, this is a community analysis of Dunedin, presented to you by Lindsay Vandervelt, Kaylee Helgeson, and Terry Silvera. We will be presenting a brief historical overview of the city of Dunedin, along with a community analysis that will discuss its structure, population, environment, health-related resources, and government public policy. This presentation will prioritize the problems identified in the community, and a global issue will be discussed and how our community deals with the issue versus how other global areas do as well. The city of Dunedin, best known for its village-like town, is the oldest city on the west coast of Florida. In the year 1877, a man by the name of George L. Jones opened a store in the small established settlement and called it Jonesboro. 5 years later, in 1882, two Scottish merchants by the name of J. O. Douglas and James Somerville opened another store on what is known today as Main Street. Douglas and Somerville did not approve of the name Jonesboro, so they petitioned the government for a post office and requested that it be named Dunedin, meaning peaceful rest. Not long after, people began to arrive and the settlement grew larger. Pioneers built a large dock that enabled schooners and sloops to dock, eventually housing the largest fleet of sailing ships in Florida. This created a port of trade and commerce. Cotton was grown and a horse-powered gin mill was built. In 1873, the first school in Dunedin was established, composed of one teacher and 17 students, along with the city's first bank called the Bank of Dunedin, established in 1913. The first hospital was eventually established in 1937 by Dr. Meese Jr., and which is known today as Meese Dunedin Hospital. Today, Dunedin's population is 35,690 people, and the bustling city is inhabited by all walks of life, partaking in the town events and walking, running, and bike riding along the Pinellas Trail. It is home to many historical buildings in addition to the Dunedin Marina, filled with swaying sailboats.
Compared to surrounding communities, the 10.4 square mile town of Dunedin goes above and beyond to meet the structural needs of their residents. The Pinellas County Department of Community Development and the Dunedin Housing Authority Partnership works in collaboration with the City of Dunedin to assist residents with their housing needs. The goal of the partnership is to offer affordable housing opportunities to individuals and families that would have difficulties achieving home ownership otherwise. Eco Village Dunedin is newly constructed mixed income development with plans to build 25 affordable townhomes. The homes will be green certified, utilizing solar panels to minimize electric bills for tenants. Dunedin is home to 34 churches of multiple denominations, including Methodist, Christian, Lutheran, and non denominational. There are 12 public and private schools located within Dunedin city limits, ranging from preschool all the way through high school levels. One of the biggest issues noted in Dunedin from the windshield survey was the lack of free parking structures located in downtown Dunedin, primarily in areas during business hours, evenings, and weekends when tourism is at its peak.
Persons over the age of 65 has more of an increase in heart disease, respiratory disease, diabetes, falls, and cancer. 27.9% of the population of Dunedin is greater than age 65. Racism and prejudice can play a part in this city due to the fact that 91.1% of the population is Caucasian. This is a significantly higher percentage rate than the other races such as African American, Asian, Hispanic, or Latino in the population. Education is important in life because it enables people to contribute to their community and society. 91% of Dunedin's population only have a high school diploma, and 21.4% are middle income, earning $50,000 to $74,999. Dunedin is a part of Pinellas County, and rates of chlamydia and gonorrhea are higher in Pinellas County than the state of Florida itself. Chlamydia reaches a peak of a reported 424,000 people in the Pinellas County compared to the state of Florida that has 396,000 reported from the years 2009 to 2011. Gonorrhea was also shown up to have 141,000 cases reported in the same time frame in Pinellas County in comparison to 108,000 reported in the state of Florida. There are many types of health-related resources in the Dunedin area. Meese Dunedin Hospital is the only hospital serving all of Dunedin's population. It is located near downtown Dunedin. Different units such as critical care, behavioral health, orthopedic, emergency room, and many others serve different patients with different needs, although pediatrics and OBGYN are not practiced at this hospital. The hospital is open 24 hours a day, 7 days a week, and they take insurance as forms of payment, but also have payment plans and financial assistance programs that help their patients pay for their medical coverage. Manor Care Health Services and Meese Continuum Care both serve long-term care patients and patients that have a post-hospital injury that needs rehab services, such as physical therapy, occupational therapy, and speech therapy. Hours of operation are 24/7, and Medicare Part A pays a percentage of the stay along with the patient's insurance as well. Walk-in clinics such as healthcare clinics at Walgreens and Minute Clinic are retail clinics that are staffed with the nurse practitioner. These clinics are dispersed throughout the city of Dunedin. The clinics allow patients to walk in and treat their different symptoms such as respiratory infections, asthma, and allergies. They are both open throughout the day on the weekdays and weekends until 5:30 p.m. on the weekends. A typical visit can cost $71 to $125 depending on what is needed at that visit. And in reference to Healthy People 2020, some specific community objectives applicable to the City of Dunedin is access to healthcare, substance abuse, and family planning. Objective AH6 intentions to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care, dental care, or prescription medicines. East Dunedin Hospital is the only hospital serving the population of Dunedin. There are several assisted living facilities, skilled nursing facilities, and walk-in clinics around the area. Objective SA14 reduce the proportion of persons engaging in binge drinking of alcoholic beverages. Downtown Dunedin has become one of the most notorious places of a nightlife with numerous bars and clubs within walking distance of each other, making it easy to access to multi-varieties of alcohol consumption. Objective FP8 reduce pregnancies among adolescent females. Family planning allows the teenage population to decrease the risk of teen pregnancy. In the Dunedin area, there's a limited amount of family planning resources for adolescents. In other surrounding areas, there are establishments such as the Kimberly Home and the Health Department to aid in pregnancy prevention.
Based on the community assessment assignment, Dunedin ranks high in terms of adequate environmental resources. Curbside and drop-off recycling is available to all Dunedin residents at no cost. 2 recycling drop-off centers are also available to Dunedin residents accepting plastic bottles, aluminum cans, newspapers, and more. The City of Dunedin has an independent water system that does not rely on regional resources to meet the community's needs, unlike surrounding communities such as Clearwater and Palm Harbor. Green Dunedin is the umbrella term adopted by the city's commitment to sustainability while addressing the environment, economy, and society. Dunedin's Community Garden is just one of Green Dunedin's programs in which members can rent organic garden beds throughout the year for a small fee, with the commitment of volunteering to maintain the garden's upkeep. In 2016, Dunedin received an overall score of 97.6% in terms of air quality, categorizing the city's air as good. With a crime rate of 28% less than the national average, Dunedin is considered to be safer than 53% of U.S. cities. Based on observation through the windshield survey, potholes were noted along various Dunedin streets, including the west side lanes of the Dunedin Causeway Bridge. In talking with patrons of the Dunedin community, collective issues contain matters of uncollected trash and debris along roadways, mosquitoes, and increased amounts of graffiti throughout the city over the past year.
Dunedin has 1 mayor and 4 commissioners, and according to the city clerk, Ms. Denise Kilpatrick, the mayor and commissioners are readily accessible at the Dunedin webpage, dunedin.gov. There you go to the government section. There you will find the information needed for the mayor and commissioners along with email addresses and contact information. Also, according to Ms. Kilpatrick, public meetings are well attended and one can either watch online or attend the meeting directly. In looking at the financial chart and graph, one can see the areas in the community that the budget covers, such as City Commission, Fire Department, Parks and Recreation, etc. In speaking with Mr. Miller, who is the head of the Financial Division for City of Dunedin, he mentions that the city also provides for services that increase the community's quality of life, such as the marina, library, and spring training for the Major League Baseball team. He says there are always more community needs or economic concerns that the city budget can't afford, but the city does its best to meet the needs of the community above and beyond the normal budget. Diabetes is a significant disease process that is affecting our community and has been selected as our #1 community need. Since diabetes is associated with multiple chronic conditions such as affecting the cardiac, respiratory, and renal system, it has been selected as our #1 community need. According to city data, 9% of adults who live in Dunedin have diabetes. An effort to improve community health, East Dunedin Hospital is working toward increasing faith community nurses and providing diabetic screening in the Dunedin community. The focus is to increase education and accessibility for residents in the preventative care of diabetes. The second overall community need is for the homeless and poverty group. According to the United States Census Bureau, there are over 8% of the Dunedin community living in poverty. Homelessness and poverty are a community issue that needs to be addressed. Homelessness and poverty can lead to increased health disparities and diseases processes such as HIV and tuberculosis. Fortunately, in Dunedin, there are places such as the HEP Center, which is a homeless empowerment program that provides food, shelter, and clothing for people and families in need. The author, as a health care nurse, has personally provided care at the HEP Center and has taken care of many transient individuals who are there who smoke and drink and are very questionable in behavior. The homeless poverty issue in Dunedin has been given second in overall community needs. Alcohol was selected as the third overall community need. According to city data for Dunedin, it identifies 88.1% of the Dunedin adult population that consumes alcohol daily. With popular bars such as the Dunedin Brewery, Dunedin House of Beer, and the Flanagan's Irish Pub, there is an increased alcohol consumption in the Dunedin area. Fortunately, in Dunedin, there is a safe house that provides support for alcoholics with programs such as Alcohol Anonymous. Alcohol has been placed at third on our overall community need because of the high level of adult alcohol consumption in the city of Dunedin. Smoking was given the fourth overall community need that is important for the community nurse to address. With the many bars Dunedin has, drinking and smoking are clearly a health concern for the community nurse to address. Education is key on how smoking can cause serious health issues such as COPD, cardiac issues, cancer, and peripheral vascular disease. According to city data, Dunedin is third on the list of the top 101 counties with the highest percentage of residents that smoked 100+ cigarettes in their lives. Because of the high level of individuals who smoke in Dunedin, it has been placed in the fourth position of overall community needs. The Affordable Care Act is selected as being number 5 for overall community needs. According to the United States Census Bureau, there are greater than 13.8 of Dunedin residents who do not have health insurance. This is where it is important for community nurses to be an advocate for residents to have access to affordable health care insurance and medical care. It is imperative for underserved populations to receive the medical care they need, such as dental, specialty care, and mental health. East Dunedin Hospital is part of the effort to push for the affordable health care access insurance. Because there are greater than 13.8 of the residents in Dunedin who do not have health insurance, it has been placed in the fifth overall community need. Domestic violence is selected as being in sixth place for overall community needs. It is also an important issue that the community nurse needs to address. According to Florida's County and Jurisdictional Report, domestic violence offenses for 2015, out of a total population of greater than 35,000, there are 161 incidences of domestic violence at the city of Dunedin. Fortunately, Dunedin has programs such as the HEP Homeless Empowerment Program that supports residents who are victims of domestic violence. Because of the level of domestic violence incidences, it has been placed at the sixth overall community need.
In 2015, there were over 11 million documented cases of diabetes in Mexico. It is one of the top 2 causes of death in the country next to heart disease. Lack of exercise, fatty food, and drinking sugary drinks are among major components of the problem, as Mexicans drink more Coca-Cola than any other country in the world. At this point in time, recent government actions to prevent and control diabetes in Mexico include the launch of a system of primary health clinics focused primarily on obesity, diabetes, and high blood pressure by the Federal Administration of Mexico, regulating food distribution in primary school systems, implementation of self-support groups, and by increasing the knowledge of healthcare personnel on diabetes. East Dunedin Hospital provides diabetic health screenings, continuing to ensure nurses are certified to provide education on diabetes to patients and provide diabetic kits to indigent patients to monitor their own blood sugar. A community health nurse in Dunedin could intervene on the topic of diabetes by setting up a community health booth outside of a local grocer and provide pamphlets to raise awareness on the disease, including healthy, diabetic-friendly foods and recipes. Thank you.